Good morning, everybody. Good morning. My name's Joshua Tepper. I'm the President and CEO of Health Quality Ontario, and it is a unique privilege to welcome you to Health Quality Transformation 2015. I know with some subway delays, excitement about the game later today, there's still a number of people registering, but I think we've got a fantastic day ahead of us, and I think we will start. People will continue to fill in and join us throughout the day. It is a remarkable day. It is a remarkable opportunity to be here with well over 2,000 people, hundreds more than last year. What is clearly the largest quality conference in Canada in healthcare. This is the third one I've had the privilege of attending. The first, I admit, I'd been on the job for about 8 days or something, so this is sort of my second. And each year, it is just more and more people, a phenomenal group of speakers, patients from across Ontario, healthcare leaders literally from across Canada, patients, an unprecedented number of patients here. And actually, last night I got an email, even the girl I took to the prom in high school. We haven't met since. It was a lovely evening, but she said, I'm going to see you tomorrow. So I was, it is amazing the community you bring together for a conference. I know that at these types of events, it is traditional to have a phenomenal day, and then to end the day with some well-deserved thanks. I'm actually going to propose that today we start with some well-deserved thanks. Putting on a conference where about 3,000 people have registered, dozens and dozens of speakers, a complete new separate stream designed with and for patients and the public takes a phenomenal amount of work, literally almost a year of work. We start at the end of the day, planning for next year, which meant that a year ago, we started planning for today. Almost the entire organization of Health Quality Ontario is here today. You've seen them at registration at the back of the room, helping you get settled. And at the head of all of this are two really important members of our organization, Susan Taylor and Suzanne Dugard. They are probably not in the room, but a huge round of applause. It really has been a tireless amount of effort from those two and the incredible team around them. It's also a chance for us to talk a little bit about what we're doing at Health Quality Ontario. You'll hear over the course of the morning and the day about our reports on measuring up. On your seats, you have a really important Quality Matters document that we'll talk about in a little bit more detail with a video. But I want to take a moment to talk about two really important elements that Health Quality Ontario is focused on. And I mentioned starting this job about 2 years ago, almost to the day. In the first week on the job, I met with Shalom Gluberman, who started Patients Canada. And he said to me in that first meeting, you should always start your talks with a story of a patient. And actually what I want to do today is actually use the story of two patients to talk about where Health Quality Ontario is focused. So this is Isla. She's 23 days old, and she's my daughter. Thank you. That's my wife in the back applauding. And actually over the next hour, I will be showing you photographs and videos of her first 23 days of life. Nervous laughter, really? Like an hour? So we're really lucky. Isla is a beautiful and healthy young girl. And by every measurable outcome, her weight was good, her APGAR scores were good, her exam was perfect at the time of birth. But the reality is that unfortunately it was not a totally smooth pregnancy. The reality is there were times in that pregnancy, and I have my wife's permission to share this with you, before anybody's like calling, do you know what he's doing? This is actually just for my prom date to let you know I've moved on. I'm good. The reality is that we had some bumps in that 9-month pregnancy, some really difficult moments. And I can think about one time when a healthcare provider sat down and told us some very difficult news and proposed a very difficult treatment plan that left us both upset And as my wife literally started to tear up, said, "Wow, you're very upset," got up and left the room, leaving behind a very confused learner, not sure whether to stay and try to comfort and explore the experience that my wife was having or to follow the supervisor out of the room. And then, at the time of birth, we had this incredible interprofessional team with a midwife and a high-risk obstetrical specialist. Actually, there was a midwifery student, a nurse, nursing student. I was lucky to get into the room, actually. And we had this incredible experience on the day of the birth 23 days ago, in which all of these team members sat together and actually asked her what she wanted for that day. They asked her what her birth plan was, what she wanted, and actually asked her the experience that she wanted for the birth. And it was phenomenal. And she was able and fortunate to have exactly the experience she wanted. And so the challenge is that if we only look at the APGAR scores and the birth weight, we actually don't know what it was like for my wife. We don't actually know what the experience was for the patients who work in our system every day. And we won't know that until we ask them. And we won't know that until we involve them. And we won't know that until they sit on our panels and sit on our committees. And so one of the things that Health Quality Ontario is absolutely focused on is making sure that the voice and the experience of the patient is in everything we do. And you will see that throughout the day today. You see it as very proud to be one of the first conferences in Canada to have a patients included logo as part, because we've earned that logo by having patients involved in the co-design. Our report that goes out today has patient stories throughout it so that we really understand and involve the patients in everything we do. This is Richard. Richard was a member, not a member, he was a patient in my clinic. I'm a family doctor. And Richard was a patient in my clinic, and about 2 years ago, in December, a few blocks from here, outside of a grocery store that used to be a very famous hockey arena, and is now a very large grocery store, Richard actually froze to death on December 23rd, one of the busiest shopping days of the year. And he froze to death slowly over a period of many hours as people walked by on the busiest shopping day of the year. And the remarkable thing, perhaps, isn't just that people walked by, but actually that he died within 1 kilometer to 1.5 kilometers of billions of dollars of healthcare resources and investments, including my clinic, which is just a couple blocks away from where he died. And the other sort of disturbing but remarkable thing about Richard is he died in his early 50s, which actually is about 5 years later than the average age for a homeless man in Toronto who lives on the streets, and about a decade later or more than a homeless woman on the streets of Toronto. And so when we think about what quality means, we actually have to think about what quality means for everyone, like the people like Richard. And we have to realize that if we want to improve quality of care, if we really want to improve quality of care for all, we have to focus on equity. And so one of the key things that you will hear and see from Health Quality Ontario in the months and years ahead is a relentless focus on equity. We will talk about income. We will talk about language. We will talk about Aboriginal status. We will talk about income status. We will talk about new generation Canadians, because these are the factors that help shape the quality of care for the people who live in this great province. And we need to understand that if we want to help people like Richard, who had mental health, who had addiction issues, had spent much of his life in and out of jail, that we actually need to ensure that we have a healthcare system that is totally nuanced and supportive and broad enough to address each and all of those issues. So actually, I'm going to do something that I've done twice before, which I actually want to end by sharing a poem that was written by another one of my patients in the same clinic. I don't read poetry often, but he brought this in to me one day. I shared it with some people when I first received it, and I wanted to share it again today. He's given me permission to use both the poem and his name. His name's Grant Ellis. And Grant has spent much of his life in and out of mental health institutions. He spent some of it in jail. He is chronically, fragilely housed or homeless. He has been incredibly difficult to treat and manage. His schizophrenia is very difficult. We have tried numerous types of medications. We continue to try medications to deal with the side effects. I see him almost every week or every couple weeks. And he came in one night and he handed this to me. I work my evening clinic on Monday nights around 5:30, 6 o'clock. And he walked in and he said, I want you to have a copy of this. In fact, what he said is, could you type this up for me on your computer? So I sort of did my routine, and then I sat there and I typed this up and I asked him for a copy. Walking the streets late into the night, I thought perhaps I might find the light. Prayed to my God could remove all my pain, yet it seems all remain the same. I pondered as I sang all those old school songs about how I'd been so darn wrong. I felt no relief from the ache in my soul. I yelled, I got angry, I lost all control. I pleaded with God to change up my mood. I implored him to change what had already ensued. Still though, I felt that familiar hurt as I wiped from my brow the grime and the dirt. Freshly I headed on a new course that day, wearily trying to find my way. And then at long last I felt my dear Savior say, all will go well if you but follow my way. The religious tone may or may not appeal or resonate to you, but what should is a healthcare system that is rich enough and sustainable enough for my daughter Ayala at 23 days, and rich enough and strong enough to allow somebody like Grant to produce beautiful words like these. Thank you so much for being part of our quality journey today.